ADHD is the most common neurobehavioral disorder in children. It occurs in 8% of kids and youth. More boys than girls are diagnosed with ADHD. Adults, too, can be diagnosed with the disorder. Dr. Michael Lyon is an expert on attention deficit hyperactivity disorder. He is the medical and research director of the Canadian Centre for Functional Medicine in Coquitlam. His specialties include ADHD, diabetes, environmental toxicology, and chronic pain. It is my pleasure to welcome Dr. Michael Lyon back to Studio 4 to tell us more.
Good morning.
Did you fly in this morning?
No.
Okay, because I know you live in Nanaimo and sometimes you land that chopper.
Oh, that was years ago.
Because you do have a license. Was that years ago?
Years ago, yeah.
Okay, so functional medicine, ADHD. Where to begin? What is it, ADHD?
ADHD is a condition, if you want to look at it a little differently, it's a condition where the part of the brain that filters normal thoughts and impulses isn't as developed in kids of equivalent age. So you have a kid with ADHD and this area in the front of the brain called the prefrontal cortex that is there to filter out whether you should jump up and do this or that, or whether your mind should wander this way or that way instead of staying on task. That part of the brain isn't fully developed for the age of that child, and it's also an area of the brain that's under functioning. And so it results in a kid who tends to be either impulsive or hyperactive or has problems with attentiveness, easy distractibility.
Easily distracted. Are kids born with it? Is it caused in the womb? Do we know why?
It's clearly a multifactorial disorder. I mean, there's a multitude of factors. There's certainly a genetic link there. Most kids with ADHD, you can see it in their ancestry, in their parents, perhaps their grandparents, other siblings, and so on. But there's also, for sure, developmental or environmental causes and things that can be modified or corrected to improve the condition.
How early can you spot it as a physician? How early should you spot it as a parent?
Yeah, you could suspect it even in infancy in some cases, but you can't officially make the diagnosis until the child's about 7.
And what tests do you do?
There really isn't a specific test like a blood test or an MRI scan or anything. It's something that has to be diagnosed clinically, meaning that it is a collection of symptoms in more than one location, usually home and school. Has to be corroborated by both parents and teachers and so on. So it's really a judgment call more than it is a diagnosis like a blood test.
And more males than females? Why?
It may not actually be more males than females. It's that males tend to be more obvious that they have it. They tend to be more likely to be hyperactive or aggressive or impulsive, whereas girls tend to be more likely to just be the daydreamy girls that sit in the back of the class, don't disrupt the class, but aren't really paying that good an attention to things.
Okay, so busy brain, wandering off, wanting to be someplace else, or not, just not paying attention.
Yeah, exactly.
So the focus for both, because they say more boys have it, but you say maybe not.
There certainly is probably a higher prevalence in boys. There's genetic, again, the genetic side of it points to boys being more likely to have it. But there's certainly more girls that have it than we previously realized because they tend to be the more quiet, primarily inattentive kids.
And how is it linked to sleep or sleep disorder?
We do know there's an association that most kids with ADHD have less than ideal sleep. Now, parents may not be aware of that. Our study that we just published, for instance, we surveyed the parents to ask them whether they thought their kids had a sleep problem. Most parents said no. But when we measured the kids' sleep quality with a device that measures their activity through the night, it's a wristwatch device that they wear that measures every movement.
Right.
It's an accelerometer that records every movement, so that if you're sleeping soundly, you're quiet and still most of the time. If you're restless in your sleep, you tend to be fidgety and moving and scratching and itching and turning, and that device records it. Well, we found that most of the kids in our study, we just looked at boys in this case with ADHD, about 100 boys, and almost all of them had disordered sleep with this device called an actigraph.
So not awake at night necessarily, but moving around, restless.
Yeah, and so why is there an association? We don't know. It's one of those chicken or egg scenarios. Some kids with disordered sleep and ADHD have enlarged tonsils and adenoids, and if they were to get those out, they would breathe better, and their sleep wouldn't be disrupted by periodically stopping their breathing at night.
Right.
Some of these kids actually get apnea. So, you know, there are certainly correlations between disordered sleep and breathing problems in some kids.
Sure.
But other kids, we don't know. It might be the way that their diurnal rhythms work. A lot of kids with ADHD secrete stress hormones in the evening when other kids are starting to wind down and sort of coming in for a landing and sleep. Kids with ADHD tend to start getting wound up, like little tots.
So if you have a child who gets wound up rather than wound down at night, what to do?
Melatonin's been studied by several centers, including UBC, and it appears to be safe, at least in short term. Melatonin helps you get to sleep, or helps kids get to sleep, but it doesn't necessarily keep them asleep that well, and they can all actually wake up in the morning groggy with it. But it probably is relatively safe, and a lot of pediatricians are now suggesting it. It's certainly safer than the drugs that are available for sleep. What we studied in our study, we did a double-blind placebo-controlled trial of an amino acid that was originally found in green tea called L-theanine, and that's available as a nutritional supplement approved by Health Canada. And we showed in our double-blind study of 100 boys that it significantly improved sleep quality as compared to placebo. And we were giving the L-theanine after school, not right before bed, with the thought that it might help kids kind of mellow out during the evening and sort of start to come in for a landing rather than getting wound up, and that truly appears to be
so that
what
they
it
actually
did.
do their homework?
Yeah.
You mean that works? But L-theanine, that's interesting, because the green tea seems to me to be a stimulant.
Well, green tea has caffeine, so if you just give kids lots of green tea, you'll probably
don't do that.
Make them a bit more hyper because of the caffeine, but the theanine helps to calm them down. You can take theanine as a pure nutritional supplement, and then you don't get any of the caffeine. So that's how we studied it.
And does that work in adults too?
It is a very nice supplement for people who feel kind of stressed out or feel like they're a little scattered because they're just feeling
You've had
edgy.
one of those days?
Yeah.
So routine important to all children, or more important to children with ADHD? Where do you weigh in on that?
Routine is huge. Kids with ADHD have trouble organizing things internally, so they really need to be helped to develop structure externally, learn how to make schedules and to-do lists, and be forced to clean their rooms regularly to keep their environment orderly, because if their external environment is orderly and they have things like schedules and to-do lists and so on, externally it frees up their brain to do what their brain does maybe better than other kids, like think creatively and think intuitively and so on. So, you know, there's a lot of tools that
No
can
video
be used
games at 8 o'clock.
No.
No, probably not. Are there certain foods that spike this? Too many carbs, too much chocolate?
That's the biggest controversy,
Sugar.
is the nutritional connection to ADHD, but over the years, as studies accumulate, that connection appears to be much stronger than we previously thought. There are certain nutrients that are probably very important in brain development, like omega-3 fatty acids. So we routinely recommend, for instance, parents giving their kids fish oil supplements as a way to give them. At
what age? Any age?
Even in pregnancy,
age?
there's evidence that women who are pregnant their babies may benefit by them taking omega-3 fish oil supplements during pregnancy, during breastfeeding, and then all the way through childhood, you know, all the way through into adulthood. I mean, I think it's one of the things we all ought to take is fish oil supplements, and you know, and eat regular amounts of good fish like salmon and so on.
If you did not interfere with a child who had ADHD, would a boy or a girl outgrow it? The brain heals, the brain gets better. What happens?
Again, we're talking about something that isn't just a diagnosis like, you know, you have this or you don't. Certainly there is a certain wiring of the brain that's just inherited, and you probably possess that forever. If you don't adapt appropriately to that perhaps unusual brain wiring, then it may be a disability that you have to drag along through your life. But if you learn to adapt and find where your strengths are, this is particularly important for parents to find out, if they have kids with ADHD, find out where their talents are, help them develop self-esteem where they can excel. Help them find something they're really good at and feel good about that, so that they can have confidence, start to develop around that. That's certainly, like I was diagnosed with ADHD previously, and my parents encouraged me and told me I could do anything with my life, and they just made me feel so good about myself that I didn't worry about the things I couldn't do that well, and I focused on the things I could do well, and that allowed me to eventually really excel. And now I don't really think I have anything like ADHD. I have adapted, I think, very
by
much.
By refocusing, by what? Your parents recognized it important.
Again, learning to develop structure externally. Like I consider my iPhone, and I go all the way back to the Palm Pilot, as like a person who needs glasses. To me, it's a brain prosthesis. I keep meticulous schedules, to-do lists. I make sure that I organize my life externally in a device or in a system so that I can free up my brain to think creatively and do what I do the best I can.
Okay, because it's not linked to intelligence in any ways, I'm assuming.
No, in fact.
Not that you're not highly intelligent, but you know what I mean? Kids who are ADHD are as bright as kids who don't have ADHD.
Yeah, I mean,
generally.
There's a spectrum, of course. There's kids who are very, very bright with ADHD, and there's kids who are not as gifted academically, but certainly I think ADHD often comes with some sort of giftedness if you look for it. It may not be in a specific academic area, but it might be, say, in a trade or an artistic expression.
Something that captures your passion, that captures your attention, that keeps you focused. Side effects of stimulant medications, it's an option.
It's certainly sometimes a lifesaver. I mean, there's kids who probably couldn't function in this world without medication, at least for a period in their life. But again, I think that medication, like in many cases, like if you have high cholesterol, you should do whatever you can with your diet and with your exercise to see what you can do without the medication first in most cases. And that's, I think, true with kids with ADHD. Doctors should be meticulous to try to uncover causes. You know, there are kids who have, say, sleep apnea. That needs to be treated. You shouldn't put a kid with sleep apnea on a stimulant medication without treating their apnea.
Right.
Some of these kids just have severe nasal allergies. I did as a kid. I had no idea that I needed that treated until I was in medical school, actually. And I probably had apnea through most of my childhood.
So you probably didn't sleep much because of that. I have a friend who has a snore machine now, and he said he missed most of his life. He was always in a fog.
Yeah.
Because he really wasn't sleeping, didn't know he wasn't.
Sure. So I'd say, you know, first of all, treat the cause if there's a cause to be treated. Focus on nutrition, on lifestyle, like getting kids into exercise programs and sports and things like that.
Okay. Have you written a book on this?
A couple, but they're out of print. You'd have to dig into Amazon and probably buy a used copy.
Okay, and what's next for you?
Or go to the library. My focus is on obesity research, and the connection there is that kids with ADHD often are the obese kids. So there is a big connection there, and we see that you know, all the way through life.
Really? So is that hormones? Is it insulin?
Again, we just today in the Vancouver Sun, for instance, there was a study out of Harvard that linked sleep disorders and shift work to an increased risk of diabetes and obesity. So, you know, we've seen this connection. We know it goes way back into childhood. So my interest is in the sort of the subtleties of how the brain governs our appetite, our blood sugar, things like that.
All of that.
And we're doing some really interesting research through UBC, looking at things like PGX fiber that helps to normalize blood sugar, and you know, these are the things that I think
it's the future.
Is the future.
Fascinating. Come back.
Okay. Sure.
Thank you. Nice to see you again. Dr. Michael Lyon, Medical and Research Director at the Canadian Centre for Functional Medicine. And Shaw is pleased to announce the 2012 Fill the Food Banks campaign begins April 16th. For more information, visit togetherisamazing.com. Remember, you can catch all of our conversations on YouTube or follow us on Twitter at Fanny Studio 4.